MS-39 is an advanced device for analyzing the anterior segment of the eye. It combines Placido disc corneal topography with OCT-based anterior segment tomography to provide 16mm diameter cross-sectional images, detailed views of the corneal structure and layers, with a resolution of 3.6 micrometers in tissue, and advanced topographic representations of the anterior segment of the eye. Additionally, the MS-39 features pupil diameter measurement, meibomian gland loss analysis, and tear film stability assessment. The AS-OCT corneal mapping modality is developed to collect, in a single acquisition, all available biometric measurements of the anterior segment of the eye, which are displayed with topographic maps and indices. These information are then organized into diagnostic summaries for conditions such as keratoconus and glaucoma, as well as for wavefront analysis and intrastromal corneal ring surgery planning. The epithelial thickness map is crucial for detecting and diagnosing subtle corneal abnormalities and diseases, guiding surgery decisions and monitoring the effectiveness of therapeutic interventions. A comprehensive summary of the most representative corneal maps is presented, including anterior and posterior curvature and elevation, corneal, stromal, and epithelial thickness maps, as well as advanced indices for detecting corneal ectasias. Keratoconus summary assists the surgeon in classifying corneal conditions to determine the patient's candidacy for refractive surgery. This display enables the mapping of flat cap regularity, minimum and maximum depths, assisting refractive surgeons in planning enhancements for further flap cuts and residual stromal thickness planning purposes. Anterior chamber morphological parameters, such as corneal sagittal depth values and the slope of corneal scleral reference points, are depicted in a 2D schematic summary to aid contact lens specialists in the selection or in the design of the best scleral lens. The AS-OCT sections modality enables the acquisition of high-resolution tomographic sections for diagnostic purposes. Various scanning patterns can be utilized to obtain cross-sectional images, which are essential for monitoring surgeries involving the anterior segment of the eye and for supporting contact lens applications. Both manual and automatic calipers can then be used for a quantitative assessment of the anatomical and non-anatomical structures. The integrated pupillography module allows for the evaluation of pupil diameter across scotopic, mesopic, photopic, and dynamic lighting conditions, providing essential information for many clinical procedures which seek to optimize vision quality. Based on Placido disc rings reflection, MS-39 is able to evaluate tear film stability through a non-invasive tear film breakup test. The infrared illumination is utilized for imaging the meibomian glands. Software analysis and grading scales assist physicians in evaluating meibomian glands loss. OCT-based ocular biometry provides fast, non-contact acquisition of all key parameters required for accurate IOL calculation, including but not limited to axial length, anterior chamber depth, lens thickness, and keratometry. IOL power can then be calculated using Kane, EVOV2, Pearl, DGS, and the Hoffer QST suite.